Okay, hi everybody. This is our second video. We're going to talk about deep or nasopharyngeal suctioning. You're going to use this with your baby that is, despite your nasal suctioning, they're still having a hard time breathing. Sometimes our RSV kids, the bronchiolitis kids, have some pretty thick secretions. This is a process that the RTs typically can do, but if you are trained in it and if they're busy, then this might be helpful for you to go ahead and do. So for the nasopharyngeal, you're going to take your suction catheter. In this case, we have a 5 French. How you choose your size is you want to go about 1/3 of the size of the nair. Okay? So you definitely need some saline for this, saline bullet, and most likely some lubricating jelly as well. What you're going to do for measurement is you are going to measure from the nair to the earlobe, okay? And just note what that is. For this baby, I think it's a 6. It might even be helpful just to leave your fingers there. Again, you're going to have some friends help you. Make sure that baby's head is nice and stable. If that baby is super goopy, their nose is super goopy, you may not need any lubricating jelly, but if it's not, go ahead and use a little bit of that. Be careful with the real small catheters. Sometimes that jelly can kind of occlude the catheter itself. So you can use that, or you can use some saline. Prepare your mom or your parent and your baby. So you're going to go ahead and note how far you're going to go. You are going to hook that to suction. You're going to use about 100 to make sure you get a good suction on there. You're going to go ahead and insert that into the nair, all right? And then you're going to apply suction on the way out only. So no more than 6 seconds. So about 3 to 6 seconds, you're going to walk that catheter out, all right? Typically, you're going to give your baby about 30 seconds to recover, and then you can go to the other nair and do that side. You might need to clear that catheter with some saline after you've done the one side. So things that this could cause on your baby, contraindications could be some laryngospasms. Your baby could have some bradycardic spells. So you want to make sure you have an ambu bag ready to go just in case. But this is real helpful just for those airways that are not being cleared by nasal suctioning.